Well, hi, this is Jay Arthur. And if you've been around healthcare for a while, you may have run across the Healthcare Data Guide by Lloyd Provost and Sandra Murray. And in here, they describe how to start to use statistical process control and things of that nature to improve healthcare. And so what I thought I'd do is just take some of the data that's in here, and if you have the QIMacros installed, you should notice that you'd have that menu. And then if you go to File and Open, there's actually, in My Documents, you'll find there's a QIMacros test data folder, and in there you will find that we have put in the healthcare SPC file. We actually have a healthcare data guide file as well. So the first piece of data that's actually in there is on page 53, and they're starting to talk about how we want to be able to kind of normalize data based on the population, what's at risk. And so here you can see we have, by month, we have number of falls, but we can also convert that. If we have bed days, we know 6 on 600 is different than 5 on 700. And so what we want to do is go ahead and show this in various different ways. We could also calculate the falls rate per 100 patients, 100 patient days. All right, so this is all the kind of data we would start with. So the first thing we could do is take what's in the first two columns here and actually create a run chart. And in the QIMacros, we have a pull-down menu where you click Run Chart. It'll prompt you for titles. And so there's a run chart. Now you can see our median here. You can see it looks like something's going on here. But is there really something going on? The hard part about a run chart is it's hard to tell when something has actually gone bad. Now, they used to be easy to draw, and that's why people use run charts, but now you can do a control chart just as easily. So falls per 100 patient days here. So we have falls and bed days. Well, can a patient fall more than once? Well, the correct answer would be yes. So we could use a U chart. Or if you don't know what chart to choose, just click on the control chart wizard. It'll ask, can there be more than one defect per unit? In this case, more falls per patient. And the answer is yes, right? And so I would go ahead and calculate a U chart of that data. And here you can see that the data is actually, when you change all of the issues here for the various sizes of patient days, it's a very stable process. We can count on it to be somewhere around 0.008. Now we could also take this data and we could do a run chart of the falls rate itself. And again, we're going to use the median. And here you can see we have a median, and here's the falls rate, which has some dips and things in it, but you still can't quite tell what's going on. And then we could come back in, we could take that same data and run that as an XmR or individuals chart. Or if you don't know what chart to choose, the Control Chart Wizard will figure out automatically that that's an XmR chart. Now we added the Control Chart Wizard back in 2006 because I found people had a very hard time remembering what chart to choose. And so our task really is to make it easy for people to choose the right chart. Now an XmR chart will show the variation in falls per 100 patient days, month by month. So the difference between these 2 points, the first 2 points, is this point. The difference between the next 2 points is the next point. So it calculates a range of change from month to month, and then it gives us our graph. And again, you can see here we have a very stable process, and we can count on a falls rate of whatever that is, 0.8 per 100 patient days. All right, so that's a pretty easy way to go about getting more information. So again, you can do a run chart, or you could do a U chart. You could do a run chart of your falls rate, or you could actually do the falls rate itself. And I prefer this chart because I have found that people, when you just give them a control limit that's flat, then they start looking at the data. Sometimes I find when you give people something like this, which has all this variation, they start to have to understand, well, why does that bounce up and down like that? Well, then you have to start explaining, well, that's because we have different number of bed days, and then they get into the construction of the chart, which is kind of annoying, right? We want to focus on the data, not on how it's constructed. Now, another way to go at this is you could actually go into our chart templates. We have a run chart template. We could come back and copy our data here, and we could paste that data into our run chart, and that would give us a good looking chart of what's going on. If we wanted to, we could actually take this and filter it, get rid of all the non-blank cells, and then it'll tell us all the various run problems that it encounters up here on this top line. So that's one way to go about doing this. We have control chart templates, so we could have a C chart, might be another way to draw this. Copy that, paste that in here. And again, we could hide the non-blank cells. One of the nice things about the fill-in-the-blank templates is you can keep adding data. And so here you can see our falls rate as a C chart. Would be another way to go about this. We also have U chart templates. So if I go back to my original data here, I could select this data. So the falls and the bed days. And I could paste that in here. Falls rate data. We actually have some new filtering things in here, so we can filter it, we can unfilter it. I forgot I put those in there. All right, so the filtering will allow us to collapse those and just show what we need to see. We could also go in here and we could get so we could actually go in here and get the XmR 5-pack. And the 5-pack again, has the XmR data, it has histograms, normal probability plots. So I could go back to my data, copy that, and go back over to my XmR data and paste that in there. And so now I have a pretty clear chart of what's going on here, and I could filter that as well. Filter out the non-blanks, and there we see our XmR chart. The nice thing about this is you could come back in next month, select all your data, put in your next month, which would be December, and whatever your new falls rate is, let's call it 0.97, and it'll add a new data point in here, and then you could filter it. So there's a lot of different ways we can take the data that's in the Healthcare Data Guide and present that as a control chart or run chart, different types of control charts, all in the QIMacros. And all of those bits of information are either here in the control chart wizard to run a macro, or specifically under here, or we can pick up a chart template. We can get run charts over here. We can find the run chart template down here as well. So that's how we can start to take the Healthcare Data Guide and turn those into charts that'll tell us a lot more about how we're performing as a healthcare organization.